When somebody is addicted to something or struggles with a mood disorder, finding the right person to help can be a real challenge. Well, the professionals at Palo Verde Behavioral Health know that, and they take a really personal approach to see people succeed. Here to tell us more about that this morning is Dr. Chad Mosher. Good morning, doctor. It's so good to have you here.
Good morning. Thank you.
So we were talking off camera a little bit about, the problems that people go through and just how this is so personal to you and making sure that they get back on track. Sometimes it doesn't happen the first time. Sometimes it takes, a stumble and then they come back to see you. But you do see so many success stories, right?
Absolutely. We see lots of success. We see lots of change. It often means change in families of choice sometimes, being able to really work through those challenges and setting up good support networks for them.
Do you have different types of therapies just in the last few years that you see really help with some mood disorders, maybe like depression or anxiety?
Well, I think 20 years ago or so dialectical behavior therapy was something that some people just talked about. You need specialized training in it. And over the years, we've seen the increase in how expansive that particular therapy model can be with addiction, with adolescents, with mood disorders, with trauma. It's very all-encompassing, and as well as something called acceptance and commitment therapy, which uses a lot of mindfulness and cognitive work to shift people out of their stuckness.
We were talking about alcoholism and opioid addiction and also the mood disorders. You said that oftentimes the people you see have gone all the way to this final stage where they are really in dire need of help. What would you say to somebody who has a family member that they're not so sure should seek professional help at one point?
I would say look for signs that there's something maybe not functioning well in their life. Maybe they're isolating a bit, maybe they're secretive about some things, maybe they've passively mentioned some suicidal gestures or some sort of thoughts about death, and really be aware of what their behaviors are, see if they're missing work, see if they're missing school, seeing if they're calling in sick a lot, and then checking in on them and being there when they say, I think I need help.
Right, because we talk about those types of characteristics, and I think that's pretty much extreme. How would you tell somebody to approach it if they just see some of the mild symptoms? Because people can keep this hidden pretty well, wouldn't you say?
Absolutely, people know how to hide this very well. We see people who have incredible coping mechanisms to keep this from intimate family members, even spouses and children. And so I would say continue to just listen and see, are they disappearing from social events for a period at a time, or are they engaged in other sorts of activities? Do their friendship groups change?
Right. Now, specifically, what is the intensive outpatient treatment that you offer, and what is partial hospitalization? Tell us the difference.
Thank you so much. Yeah. So the partial hospitalization really is 25 hours of intensive therapy a week. It's a step down from the inpatient facility. Inpatient's a lockdown secure facility. We provide secure services, but for 5 hours a day, 5 days a week. And then we gradually graduate people into our intensive outpatient program, which is 9 hours a week. And so they're able to stay at home, they're able to communicate with their loved ones and their support networks, and possibly even continue to work if they need to, while also getting some really intensive treatment.
I think there would be a really big value to both, because you are going to be integrated back into your home life and your work life, and sometimes I think it's good to marriage the therapy with both.
Absolutely. And having their triggers in their life while they're working that through with us is exactly what's necessary.
Right. And what does this mean to you to see the success stories? Because you do, right? You often see people heal.
Yeah. It's so, I don't know how else to describe it, but sacred. It's such a sacred experience to be with someone in this process when they're completely vulnerable and also asking for help to change and making these changes in their life that maybe take years to progress towards and to implement. It's just phenomenal to see them step out into life again and really build a life worth living.
And speaking of years, in terms of healing and making the progress, how long is your program?
Sure. So most people attend our intensive outpatient program for 24 sessions, which is around 2 months. It's a good amount of time to get some work in. We can always extend that. The partial hospitalization program, 2-3 weeks, is about the max, and then we shift them into our intensive outpatient program.
Very manageable. I know that you're working with people's schedules.
Yes.
Because it is difficult when it comes to like, hey, I still have to work. I can't just leave, right?
Absolutely. And we'd like to see that. We'd like to see them continuing to work if they are, or having something meaningful in their life.
To see the success, and I know it's personal to you because I can just tell your passion when I met you before we even started the interview.
Oh, thank
so, Doctor, thank you so much. If you'd like to learn more about the services at Palo Verde Behavioral Health, you can visit paloverdebh.com, or you can call them at the number right there on your screen. That's 520-322-2888.